And we are back as we wrap up our amazing day here at AMMG Age Management Medical Group, brought to you from Boston BioLife and Joseph Krieger. We're here with Dr. Charles Guglin out of Connecticut. So this has been, we've had people from all over the United States here that I've interviewed. I'm sure there are people worldwide that have been here as well.
Yes.
Dr. Guglin, welcome.
Thank you.
Is this your first year here, or you've been involved with AMMG?
I'm a pro. I've been here, it's probably my 7th or 8th year here. I've been following this group for a really long time. They really got me started, AMMG.
What type of practice do you have?
I was a general surgeon for 35 years. I'm from the era where general surgeons did everything. I turned 58 or so, and I don't want to say burned out. I got kind of sick of the baseline healthcare system in this country, which is really about treating people who are already sick.
Right.
I got really interested into intervention, and started coming to these AMMG conferences. Met my wife here. I was part of it. But also understanding in a fundamental way that if you're going to do this stuff, you need to learn from the experts. And AMMG is one of those places, is the place where all of the people who are really the progenitors of this field of age management medicine, they cluster here twice a year. And I learn so much here every time I come.
So have you taken this and incorporated it into your surgical practice, or have you shifted gears?
Oh, no. I gave up surgery 6 years ago.
You did?
Yeah, I did my last operation in 2015 or 16.
What kind of surgery was it? What was the last thing you did?
Right.
You really want to know?
Yeah.
Yeah. The last thing I did was a young woman who had a perforating cancer of her fallopian tube who came to the hospital with no blood pressure and a belly full of blood.
They gave you an easy one.
Yeah, it was like 3 o'clock in the morning. Went on for about 4 hours.
You heard that.
Well, I had already quit before that. But yeah, it was a good finish, actually, when you think about it.
Sure.
Last thing you wanted to do was like drain pus.
You went out on top.
Yeah, exactly.
And now you've transitioned. Are you still practicing, or this is all for your benefit?
No. I have a very busy practice in Southern Connecticut. We do a full range of age management. We do a lot of hormone replacement therapy, a lot of functional medicine. And one of the things I love about this place is every year there's something new. And like this time it's epigenetics and genomic testing. Every year there's something new, and every year I got something new to bring to my patients, which is just awesome about that kind of thing.
And that's been the evolution of it. So before we had personalized medicine, now we have personalized precision medicine.
Yeah.
So there's two evolutionary pathways. One is the evolution of the technology, the compounding, and the formularies. Right. The other is the evolution of the specificity of the individual patient.
Oh, yeah.
Metabolomics, genomics, proteomics.
Yeah.
Remember, the genes are the blueprint. And then the genomics is actually the expression of those genes.
Yeah.
So the blueprint of the house itself.
That's right.
Right? And so as we start to learn the intricacies of those systems, and that's why this field moves forward, what I think is encouraging is there are thousands of doctors like him out there, but nobody knows about it. We're so conditioned to go to primary care for our annual physical, and they take your blood pressure, and they weigh you, and they look at your blood, and they say you're fine, or you're within range, or whatever.
It's literally old-fashioned medicine. I'm sorry. But
By comparison, sure it is.
This is the new paradigm of caring for patients.
But what you're seeing now are classically trained MDs and DOs are now going into functional medicine, whereas before it was your nurse practitioners and your PAs, right? That they were the functional medicines. And I don't want to say it gave it a bad name, but people who are used to going to traditional medical doctors didn't want to segue over to that because they didn't think they were going to get the same treatment.
Well, there's a confirmation bias against.
Of course, all of this
to a very large degree, because, for instance, in my practice, I do functional medicine. What feeds my dogs and pays my mortgage is the hormone replacement therapy and the things that we do. That's a subscription service, but we do a full range of age management because I do aesthetics also. As
Which
a
is
surgeon,
really
I
important.
do invasive aesthetics. We just bought it. InMode. InMode is the state-of-the-art aesthetic platform, and we just bought that, and it has enhanced my practice hugely.
I was
already.
over there looking at that.
Yeah, it's already enhanced my practice because it's a brand name that patients are actually looking for, and so they call our office looking because they know we've got that machine, and it's actually like they call it the Swiss Army knife of aesthetics, and it really is. There's so much that we can do with that platform that's helping my patients.
But you're also surgically trained. So is a patient coming to you for a procedure like the InMode versus going to the mall in a med spa to use the InMode?
Well, that's
I think there's a higher level of comfort in patients now as this is all evolving and physicians are transferring over to functional medicine saying, okay, now I feel comfortable going this route because I know you are classically trained in surgery or whatever, in internal medicine or whatever it would be.
Yeah, to a large degree, that's what drives the aesthetics part of my practice. Because there's so many, I don't mean to disparage the people who are doing it, but there's so many young nurses out there, young APRNs who have really no experience at all with doing invasive procedures, marketing dermal fillers, for instance, which can be very dangerous, with very little knowledge of facial anatomy.
Well, PAs.
I've been in and out of the human face 1,000 times in my lifetime.
Right.
I know where the layers are. I know where everything's supposed to go. You need a very deep understanding of the most complicated part of the human body in terms of anatomy is the face. And so when people see that MD after my name and they see that I've got that experience, it tends to drive patients towards us also.
Absolutely. But I love how it's changing, how the quality and the providers, so much more information and education and comfort for the patient to go and to find them. So I think the practitioners, there's more and more practitioners that are aware of the AMMG and other anti-aging conferences and what you're doing. The hormone therapy might be your bread and butter, but it's what's going to help all of us age more gracefully.
Yes.
And it addresses a lot of different disease types.
Yeah.
I mean, it's all kind of the foundation.
You know, and this was fascinating, what he's doing with neurology and endocrinology and hormones. So
Mark.
The hormone replacement therapy on so many levels is it's incredible to me.
And also the things he was talking about, cosmetic and the transition there, it's look good, feel good, right? So I mean, if you feel like crap all the time, you don't care what you look like.
Yeah.
But as soon as you start having more energy, you're losing weight, and you feel better, you know, it's behavioral, but it's also biochemical. You quit drinking, don't eat anything white, don't drink anything but water. Do that for 90 days and walk 1 hour a day. You're going to see tremendous benefit. And then when you see benefit, then you continue, what can I do next, what can I do next? So at the end, you might want to roll back some of the miles. It's like going to Mako, you get a new paint job, you change your tires, you look better, right? And I think but no, you made a good point because people feel more secure in the hands of an MD.
Sure.
And I think that's what's another positive evolutionary process. Half the doctors in this country don't work in hospitals. That means they're in private practice.
There's a lot of the evolving as people are taking over hospitals and they're under corporate again, and it's changing, and physicians are saying, I too deserve a quality of life.
There's so much cookie cutter medicine that goes on out there, and most of what we think of as healthcare in this country is algorithmically charged. You know, you go into your doctor's office, he listens to your series of complaints, and all the time he's listening, he's cataloging in his head what kind of pharmaceutical he can prescribe for whatever it is you are complaining about. Age management totally flies in the face of that to a complete degree. I very seldom prescribe pharmaceuticals in my practice. Obviously, metformin and some of the other things that we've been shown are truly helpful for things like insulin resistance and those kinds of things. But for the most part, what I subscribe are life change and a lot of supplements. We do a lot of supplements in our practice. But so much of this has to do with lifestyle change and mentoring patients to helping them transition towards changing the way they live and giving them a fundamental understanding of how that's going to impact the way their life and how they feel. To that regard, very much of my practice is curriculum driven. I'm spending most of my time teaching patients how their body works. You know?
It's been a lot of evolution, Joe. This has been an amazing conference and so much information. And you can see, even from 4 years ago,
when we did the World
how much more patient involvement there has been.
We did that, and that was just highly scientific. But the whole idea, so when I started this company 6 years ago, it was to translate science into medicine. So I figured, the pathway to the future medicine is through science. Doctors are nerds. They're going to love it. And I've always come from the standpoint of teaching peer-reviewed publication research to physicians when they want to learn. If it's radio frequency ablation for pain or microdiscectomy for low back or anything in the brain, you have to understand the pathophysiology of that cell system. So to put up a cartoon and say, well, an exosome is like a letter and it's got a forwarding address and a return address, and you put the little note inside. Doctors need to be treated like scientists. Remember, the doctor becomes a scientist and the patient becomes the healthcare provider. That pushes the train forward, right? And it allows all these new and emerging therapies to be beneficial. We know we can go to a hospital when we're going to die, and we can, right? But I think we learned a lot. I think COVID made a big difference in helping people understand the value of the immune system. But you're really where the rubber hits the road because you're in the front line. You're treating patients. You've got surgical training. You've got decades of experience, and yet this is what you're doing, right? So if that doesn't speak volumes to the value of this, in the face of everything that's been tried, like we've tried it, we've given 100 years to drugs and surgery. We got failed back complications, we got failed surgery syndromes, and we got opioid epidemics, and we got drug-resistant refractory, pill after pill. I love the commercial that shows the pill that fixes the pill.
Yeah.
Listen to a golf tournament. Close your eyes when the commercials play during the golf tournament.
Do not take it.
News.
One commercial after another.
Yeah.
I went to the dermatology show the other day, and a third of it was cancer, the other third was looking better and feeling better, and the other third of it was just junk. So but it's interesting to see how these industries react, but really patients seeking therapies go to doctors that have experience, but groups like this just aren't mainstream.
Well, it's getting more, I've seen it, the evolution of the physicians that are here, the education, the science, and getting it to the public. A lot more vendors here are more public friendly. And things that are available. Some only through providers, through nutraceuticals, which is important. But some of the skincare products and other things, the light stimulation, and that are available to the public, to private patients.
By the way, I'm not dying in a hospital. I'm going to fall off skis or off a bike.
He's
That's how
out.
I'm dying.
Are you ready to wrap this up?
Death by blonde. Okay.
Dr. Charles Guglin, thank you so much for joining us. Joe Krieger, Boston BioLife, thank you for having us. And Age Management Medical Group, thank you again for the opportunity to share all of this information out with their audience and our public. Have a great weekend, everyone. Stay safe. Be kind to each other.